Hey, David, says Don, if we can't get Medicare for all, what are ways that we could improve the Affordable Care Act? This is so. I want to deal with the question because it's a good one, but it's also so politically loaded right now because we're seeing this battle among within the Democratic Party. I will remind you, the position of the Democratic Party platform right now, if you go to their website, is not Medicare for all. It's not eliminate private insurance. It's not universal health care. It's not any of that stuff. It is Medicare opt in at age 55, lower the age at which you can opt into Medicare from 65 to 55, and a public option. That's the Democratic position. And what so we're seeing among Democratic candidates is they are being forced to take a position on Medicare for all. They're all paying lip service to it, but some are already kind of backing away. We've seen Kamala Harris back away after saying during a town hall, Medicare for all is the way. We've seen Cory Booker start to play a little coy with it. We're seeing others. So I'll give you the full list when we dive into that in depth. And so I will address the question of how, if we don't have Medicare for all, how could we improve the system we have or build on the Affordable Care Act? Just remember that this has become a very, very toxic thing related to the 2020 presidential election. It's being used by a lot of people to play games and to try to have it both ways and ride the fence in a way that we really shouldn't allow them to. That being said, how do we improve the Affordable Care Act? Number one, you've got to put right back in the individual health care mandate that Donald Trump removed via his tax reform plan. You've got to do that. That's how it's sustainable. Period. And for everybody who says, well, it's not really free stuff if we're paying for it through taxes. Yet no one is saying that any of this stuff is free. No one's saying Medicare for all is free. We did a piece on Monday estimating that Medicare for all would add about $1.2 trillion in costs per year. The problem is that we can, or not the problem, the great news is that we can more than pay for that through means that have been very specifically researched and outlined. And it would be at a net savings to employers and individual households. A 4% tax on households earning more than $29,000, for example, considering that most households spend between $4,000 and $5,000 a year on premiums and copays, it's going to save most households money, right? So just because something has a cost, it's like, okay, but what are the savings? So we should absolutely put back in the individual mandate. You need that for the system to function properly. We should add an actual public option. Okay, I'm not talking about a state subsidized option, although that's good. And we've had that here in Massachusetts for a long time. I'm not talking about really crappy, cheap, catastrophic only plans that cover nothing but are just there to meet the requirements of the individual mandate. I'm saying a genuine public option. And in addition to that, we also need to continue examining what is going on with bureaucracy and bureaucratic costs. That's a huge driver of costs in the American healthcare industry. And then you can start looking at, all sorts of other things. We should be negotiating on drugs. There's no reason why Americans, through insurance that is mostly coming through employers, should be paying outrageous costs for medications that go for a fraction of the cost in other countries. It's a very, very long list, but public option and putting the individual mandate back in would be near the top of that list. But I just reject on principle that there's something untenable about actually figuring out how to get a universal healthcare, single payer, Medicare for all, some version of that, which every other country at our level of development has been able to do.